Dr. Salomine, this one is for you. So once someone is diagnosed with breast cancer, what are the next steps? Is there a set pathway from diagnosis to treatment, or does it look different for every patient?
Maybe one step back. Let's not say you don't diagnose breast cancer, but the mammogram and the ultrasound are suspicious for breast cancer, because you can never diagnose it with a mammogram. You can have a high suspicion or a low suspicion, and you can say that you need further investigation. And the way to diagnose it is always with a tissue diagnosis. So if the patient presents with a large palpable lump, then sometimes the surgeons will do a biopsy themselves in their rooms, and we don't have anything to do with that. But very often, especially when it's just abnormal calcifications, or when it's a tiny 6 millimeter or 7 millimeter little lump that you can't feel clinically, they ask us to do a biopsy, and then it's an image-guided biopsy. So in the case of anything that is visible on ultrasound, we will always try to do the biopsy ultrasound guided. And if it's not visible on ultrasound, but there are calcifications visible on mammogram, or there's maybe a tiny spiculated area, then we can do what we call a stereotactic guided biopsy. And then we aim for the calcifications or the little spiculated area, and we can biopsy that while the patient is on the mammogram machine in compression. And then once we have the pathological diagnosis, then that gets sent to the oncologist and the surgeon, and they plan. There's not one size fits all with that treatment.
We appeal to you to get yourself checked.